This right here is a partially sagittal and then partially anterior view of the respiratory system. Now, the respiratory system being a whole bunch of organs that are working together to help you breathe in and out. So our goal in today's video is to use this 100% free Kenhub article. We've gone ahead and left a link down in the description below. You can feel free to follow along. It'll make the experience a whole lot better. But our goal is to basically see how air goes in and then out, and you can understand the respiratory pathway. However, we're going to be primarily focusing on the organs, right? The main organs of the respiratory system. Because as you can see, looking at this image, there's a lot here. And this is, and maybe this might not surprise you, this is only a small portion of what is actually there. So there's a lot to think about, but we're going to just mainly focus on the primary organs and structures of the respiratory system. So I'm going to go ahead and hit this magnifying glass. It's just going to give us a bigger view. We're not going to go over every single one of these terms. Instead, I just want to mostly look at this kind of like from broad level, high level view, just get an understanding of what is going on here. So let's start with the head, because I don't know about you, but that's where I breathe. We don't absorb air through our skin. We are creatures that need it to be taken in through tubes. And so there's basically two options of where we can breathe in, and that is going to be your nose and then your mouth. Now, let's start with the nose, because the nose right here is this cartilaginous flappy bit, right, that we all are very aware of. Now, this is made of hyaline cartilage. Hyaline cartilage is a type of cartilage you put places that you want to reduce friction, basically. And there's a lot of air friction. What do you think about this? I have a deviated septum, so ignore my stuffed up sound, but as it goes up there, right, like there's a lot of friction going in and out. It only makes sense you'd have something that is really good at reducing friction, but hyaline cartilage is also good at retaining its shape, more or less. It's not going to be as good as another cartilage we're going to see in just a moment, but it still can retain its shape, right? I can push my nose this way, and it might take a second, but it'll eventually make its way back there. It's soft, it's pliable, but it's still firm. It makes sense to have this as the outer structure. Then what happens is we go into what's called the nasal cavity. So if you removed this soft, fleshy part, what you would then see is a giant hollow space. Now, it is divided by, like what I just mentioned, something called a septum, right? The nasal septum divides the nasal cavity into a left and right portion. So for me, mine is just skewed to one side, and it kind of makes me always blocked up, but I'm used to it. It's just life. You can get used to a lot of things. But then I want you to look at these, like three little, I don't know, they look like bumps, right? These are called the conches. So you have, or the conchi. So you're going to have three of them, and what they do is they create individual nasal passageways inside of your nose. Really, really cool. Also, you can see them be called the turbinates. So you can also hear it be said that way too. But lining the entire nasal cavity is going to be a whole bunch of epithelium. And that epithelium is also going to be richly, it has just a ton of blood vessels. And that is because you need to be able to heat the air as it goes in, right? Think about it like if you're eating something that's hot, right? You put it in your mouth and we do that to cool it down. Well, when you breathe, that is also going to cool the air down. And so you need a bunch of superficial blood vessels in the area to warm that air up. But not only that, you have mucus being secreted by the epithelium inside of your nasal cavity. And that's going to be very important, right? Mucus is there to capture potential pathogens, help to act as like a filter, but it also helps to humidify the air because we want to have a very humid environment inside of the lungs. So this is one reason why you'll often hear people say it's optimal to breathe in through the nose and then out through the mouth, because then you are really taking advantage of the blood vessels and mucus to properly warm it up and humidify it. But at the same time, let's go down to the oral cavity or your mouth, right? You can see most of the tongue. I want you to know the same thing can happen there, right? You can go, and you can feel the humidity as you do that. So there's still going to be humidity. There's still warmth in your mouth. It's just not as good as you'd get in the nose. And so that's why you want to breathe in through here if you can. But the oral cavity is another option to breathe in. And then what's going to happen is both of these are going to converge into what's we would call the throat, right? Your average normal person would just call this back here your throat, but this is the pharynx. The pharynx just means throat, so it still makes sense. However, we can subdivide it. There are three portions or sections to the pharynx, and this upper portion is what we call the nasopharynx. Nasopharynx, to absolutely no surprise, is right in close contact with the nasal cavity. The important thing to understand about the nasopharynx, though, is that food and drink do not belong here. Right? The whole pharynx is a common passageway. So it's a common passageway for food, air, and drink. But you do not want food or drink in the nasopharynx, because if you get that, then what's happened is it's bypassed your uvula and soft palate and made it up into the nasal cavity, and you do not have the ability to digest and absorb and all that good stuff. So basically your nose doesn't like it, and we've all been there. You know, that moment when you're drinking something, someone tells a joke, you laugh, it goes out your nose, and then it burns. Hopefully it's not like some kind of soda or something and the carbonation is going to get you. My point is, this is not part of your digestive system. This is part of your respiratory system. That's why the oral cavity is part of your digestive system, which is why the oropharynx, which is the next portion of the pharynx, is a common passageway for all three. Right, so for food, air, and drink, all of those are going to be able to go through here, but the nasopharynx is only going to be air. From there, the tongue pushes it back, and it's going to enter into this next portion right here called the laryngopharynx, which is fun to say. Laryngopharynx is called that because it is in close proximity to the larynx. But your larynx is your voice box. So to give you an idea of where we're at, so you can see like here's the bottom of the chin. Right, we're going down, you can see the neck kind of sloping this way. And then right here, this is what's called the thyroid cartilage, this white line. In males, this can get to be larger. Due to testosterone, it becomes a secondary sex characteristic, and then that's when you can see that enlarged Adam's apple that we'll see. Now, everybody has a thyroid cartilage. It just gets larger in males due to testosterone. But this is part of your voice box. But on top, you can see there's this other white line here. This is what is called the epiglottis. And I mentioned that we were going to discuss another type of cartilage earlier. So the epiglottis and your external ear here are the only two structures in the entire human body made of what's called elastic cartilage. Remember, the nose was made of hyaline cartilage, and we will see that again as well. But the ear and then the epiglottis are elastic cartilage, and that means they retain their shape perfectly, right? So I could fold my ear, and I could hold it like this, and then immediately, as soon as I let go, it bounces right back. And it does that every single time. Where again, if I did this to my nose for like the next 5 minutes and let go, watch, it doesn't have to be 5 minutes. Watch my nose here. It looks ridiculous. It's already skewed to one side. Someone broke my nose. That's why I have a deviated septum. This is neither the time nor place. The point I'm trying to make here, the epiglottis is made of elastic cartilage because it has a very important job. When you swallow and the tongue pushes food and drink down the pharynx, we want it to go down into the esophagus, which is going to travel posterior to this tube here. We do not want that to go into the airway. I guarantee you've had something go down the wrong tube at some point in your life, and that is because the epiglottis didn't quite do its job. But it almost always does. If you think back, like for how often you are eating and drinking, your epiglottis works really, really well. Because if it doesn't and food or drink goes into the respiratory system, you can actually aspirate. You can get infections inside of your lungs. The lungs, again, just like the nasal cavity, are not part of the digestive system. So your body does not have an effective way to get rid of these particulates. And so if anything goes in there other than air, you cough like there's no tomorrow and you're literally dying, which you actually might be. Depends on what it is. So you definitely don't want that to work. And the epiglottis, what it'll do is it'll swing down and block off this opening right here to the larynx. Now the larynx, again, is called the voice box because there's also what are called vocal cords inside of there. So the vocal cords are really like vocal ligaments. There's vocal epithelium on them. But what they do is they help to create pitch. So if I go, ah, right, all of those differences are going to be happening inside of the larynx. So this is why we call this the voice box, but the larynx is there. So just as a quick refresher, we breathe in through the nose and the nasal cavity or the oral cavity. Then it's going to go into the pharynx being the nasopharynx, oropharynx, laryngopharynx, and then it goes into the larynx. From there, it then goes down into the trachea, or what most people refer to as their windpipe. The windpipe or trachea is really just a tube that is partially made of cartilage, and then there's going to be some muscle in there, and then some other connective tissues that are basically just making it look like an accordion. So if you look at this, you can see the alternating gray and white. I was trying to show you that there are these not full circle cartilaginous rings, but it's kind of like a U-shape. I don't know if I can do this right. It's kind of like a U-shape where there's muscle in the back. My point is, imagine like a horseshoe-shaped piece of cartilage and then connective tissue between them that allows it to accordion. Whoop, it goes back and forth. This gives flexibility, but also rigidity to the trachea. Right? Your airway always needs to be open. If the airway is closed, you are not breathing, and that is not a good thing. So you want to have something that is strong, but bone is too strong. You're also going to need flexibility, because imagine when you cough, it goes like this. And this is going to be true as we move into the bronchial tree as well, right? We want the flexibility to be there to help expel air, expand as we breathe deep. It's important to have mobility in there, and bone would just be too rigid. So cartilage makes a lot of sense, and I promised we'd see it again. This is all made of hyaline cartilage. So we had elastic cartilage here, but hyaline in the nose. Hyaline is pretty much everywhere else that we're going to be talking about today. So the trachea is going to come down, and then what it does is it bifurcates. It's going to split, and it's going to go towards the lungs. So let's go ahead and center this here, and we can see the lungs first. Let's talk about it. These are like these purple sacs. Now, the lungs are not actually hollow, but they are hollow. What I mean by that is, I think a lot of people, myself included, when I was first learning about this, assumed like the lungs are like these giant hollow spaces, but they're not. What you have is a series of tubes, and there's a lot of them. This is the bronchial tree. The bronchial tree, we can see it splits from the trachea, goes into the left and to the right lung, and then it's going to split again and again and again and again and again. And our illustrator, to no fault of their own, we have amazing illustrators here at Kenhub, but if they were to try to illustrate every single branch, it's going to be impossible by human standards, because these branch 33 times. So here's one branch, two branches, 3, 4, 5. Imagine doing that 33 times. You end up with this just incredible looking, essentially, bronchial bush. It's called the bronchial tree, but I've always thought of it looking more like a bronchial bush. And that is going to go until you get to the microscopic level. I can't even show it to you on this image. And that's where you're going to get these tiny little air sacs that we call alveoli and alveolar sacs. And that's where the cardiovascular system is going to come in. And that is how oxygen is then going to go into the cardiovascular system. So again, to give you a quick idea, we'll go back up here and then I'll go back to the lungs. When you breathe in, it goes to the nose, nasal cavity, pharynx, or oral cavity into the pharynx, then to the larynx, then to the trachea, then to the bronchial tree, the bronchi. So, and we can even further subdivide these into the primary bronchi, to the lobar bronchi, segmental bronchi, then a bronchial. Just keeps on going and going. But the point here is, it's just going to go whoop until it gets to this microscopic little air sacs, and that is where the blood vessels are going to be surrounding them, and the oxygen goes into the bloodstream, and carbon dioxide will actually do the opposite trip. The carbon dioxide will then go into these hollow tubes and then be breathed out in the opposite direction. But again, the lungs are not these hollow things. It's not like a giant hollow space, as much as you have a series of 33 branching tubes, right? 33 generations of tubes that are branched, surrounded in elastic connective tissue. And this elastic connective tissue allows the lungs to expand and then also to retract and like snap back, right, and retain their shape, which is going to be absolutely essential to its normal function. Right, so you breathe in and then you can kind of just, and it kind of snaps back and helps to expel the air outwardly. Now, what we don't have on this image here is kind of like the mechanics of that, including the diaphragm and then the other tissues like the pleura, but we'll leave that for a different video for another day. Instead, the last thing I want to take note of is you can see these little fissures. So what this does, these fissures here creates different lobes to the lungs. So if we were to look at this, the right lung has 1, 2, 3 lobes, whereas the left lung has 1, 2. And in the center right here would be the heart. And if you look at that, the reason why the left lung only has 2 lobes is because the heart projects to the left and kind of crowds out the space for it. Now, an interesting FYI is over here is a little hypothetical potential, maybe not hypothetical, but a potential leftover of evolution called the lingula, which means little tongue. And there is evidence to suggest that this used to be a 3rd lobe in our left lung, but the heart migrated to the left and kind of like crowded it out. And instead we have 2 lobes over here and 3 over on the right side. And again, this is all going to be made of elastic connective tissue. And then again, when you breathe out, carbon dioxide takes the reverse trip. And then oxygen is just going to go right to the heart. Then the heart is going to pump it throughout the body. And boom, that is going to be your respiratory system. So again, all of this is a 100% free Kenhub article. Now, we do have, oh, by the way, here's the alveoli. Look at those. Look at those right there. These little air sacs that everything ends with, and you can see all of the blood vessels going through and around and doing everything. Now, I will say we have videos that are premium features that are inside of these articles, but they are amazing. What they do is they go into even more detail than I just went into. We even have our quiz mode, our quiz feature, which is again another premium feature, but is without question the single best way to learn your anatomy. So I strongly encourage everyone to check this out. Again, we've left a link down the description below, but hopefully you enjoyed today's video. If you did, be sure to like this. That's how, this video can perform better in the all-powerful YouTube algorithm. Be sure to leave us a comment. Let us know what kind of other structures and organ systems and you name it, what you want to hear us talk about in future videos. We're always looking for that awesome feedback. But thanks again for hanging out with me, and I will see you next time.